CEO Live Talks.
I am Dr. Swannie Jett, and I have a passion for public health for over 30 years. Now, I'm in a position to affect change, and these are the critical conversations about health in our community with the people who can help me make those changes. Good afternoon. Welcome to CEO Live Talks. This is episode 2 with Dr. Pollio. What do you think when you see leaders, they know they did something wrong, but they don't take ownership?
Yeah.
What does that say?
Well, I think that says a lot about character. I think it says a lot about whether they are truly leading an organization. Right. So I believe this as a leader. You have to give credit. When things are going well, you have to give credit to the people that are working for you or with you. Right. When things are not going well, you have to take extreme ownership of that problem. Okay. And that's a tough thing to do. Right. But if you are the leader of an organization, you know if it's successful, you're eventually going to get credit. So it's really important to give that to the people that work with you and for you. But you know, it is critical that you take extreme ownership of problems that occur because it is your responsibility.
Yeah. Well, and it's unfortunate when you're at the top and then, you know, all the cameras on you. So your mistake is in the public view. So
it's a lonely place to be. You can look to your left and to your right during difficult times, and there's not many people there. But that is the burden of leadership. It really is. And I tell young people, if you want to be a leader, those that are trying to be principals understand this, that, you know, it is lonely at the top. And as the top, you are responsible for everything that happens beneath you. And that's a tough lesson to learn in leadership, but it's critical.
Right. I remember there were a lot of forums around, you know, neighborhood choice. Mm-hmm. Talk a little bit about your philosophy surrounding neighborhood choice.
Yeah. So, as a strong believer in this, I've been a principal in this district. I was a principal for 10 years, an assistant principal for 3 years. So in administration for 13 and then 8 in superintendent. So 21 years I've been in leadership in JCPS. So I think you have to look when you're making a decision and looking at the student assignment plan, you have to look historically. Mm-hmm. In 1976, this district and the city and county district combined into one. It was court-ordered desegregation, and essentially all students, no matter where you lived, East End, South End, West End, had to be bused to another neighborhood to achieve diversity. In 1982, the district changed that. So the only students that had to be bused out of their neighborhood for the sake of diversity were students in the West End, predominantly black students. And so for the next 40 years, students in West Louisville did not have the choice to go close to home. It was to leave their neighborhood. Yeah. I believe that is one of the most racially inequitable things that's happened in a district in the United States in years. And so what happened was our kids were being bused to really high poverty schools outside of their neighborhood. So whether that was a Valley or a Doss or a J-Town, predominantly high poverty schools, and we're going across the county, felt no sense of belonging in that school. Parents had trouble accessing the school because it was 20 miles from home. Right. To that point, we were taking students from West Louisville and busing them to Ramsey Middle School, which is almost on the Spencer County line. Right. And so my whole belief is if I live in the Highlands, which I did at the time, and could walk up to Atherton 3 blocks away and enroll my daughter in Atherton High School, then the family in West Louisville should have that same opportunity if they live 3 blocks from Shawnee High School.
Oh, that's true.
Now, they need to have another choice as well, just like I have, that if they still want to go to that school outside their community, they want to. But I heard from so many families saying, I don't understand why we don't have a choice. Right. And so I was very passionate about that. And I do think that went very well, which was very deliberate, taking a lot of community feedback. And now what we see is about 80% of elementary and middle school families are choosing to stay in their neighborhood. And that's what the community wanted. And I think all too often what we did as leaders was make decisions what's best for a community without listening to that community.
Right. It's always important. And I do remember, because I think it was Delquan Dorsey, and I can't remember who else. They did a lot of community forums.
Correct.
One of the things I did hear in a community forum was that, okay, if my kid goes to, let's say, Shawnee, I want Shawnee to look like Mel or have the same amenities.
Correct.
Is that even feasible?
So I would contend right now that Shawnee has more resources than Mayo does.
Okay.
So here is what, and they did not before,
Okay.
but here is what I believe. It's been a philosophy of mine. I've said it on numerous occasions. The students with the least amount of resources in their home needs to have the most amount of resources in their schools. Unfortunately, in the United States of America, we don't do that.
Right.
And all I would say is drive out to an Oldham County high school and drive around that high school, and then drive to Iroquois High School. You don't even have to go in the school. You can just see the difference in the facilities based on the amount of revenue that is available to that school district. And so, we, since that time, a part of this is we changed how we resource schools. So students from poverty, now the school gets more money than a student not from poverty. We now pay teachers more to work in Shawnee than what they do in Mayo. We pay the principal $10,000 more to be the Shawnee principal than the Mayo principal. We provide after-school resources. We also provide what we got a huge grant from Mackenzie Scott a few years ago of $20 million, which our goal there was just to provide those schools who may not have the alumni foundations and the PTSA dollars, and just said we're going to match those at Shawnee. Mayo may have a football game where they have $50,000 come in with ticket sales when Mayo Manual plays. Shawnee doesn't have that. We're just going to give them that money so that they have the same uniforms and the same football equipment and the same field and all of these things, the same for plays and musicals. They have that same resources. So I'm very proud of that. We've still got work to do. That's not something that's a finished product. Right. We still got work to do. But our resources we are putting into our schools in the choice zone is, I think, second to none.
So I hope they continue that, because I have noticed that just over the last decade or so, Central has changed.
Mm-hmm.
And I want Shawnee to look like that. I want Western to look like that, and Valley, because I think those schools, and it's a few others out there, that just have been left out. And I do know Shawnee had a great aviation program.
Mm-hmm. Still do.
And I think that is not talked about enough.
Yep. So we have kids going to Bowman Field out there every day to learn to be pilots from Shawnee. Shawnee was our first school to have a turf field and a new football stadium. So these are just things I think you have to do in order to meet the needs of kids. Now, I have to say this, an important distinction is magnets versus reside schools. So a magnet school is always more of picking kids based upon, an application from a parent. A reside school means we accept everyone in the community.
Right.
And so I'm a big believer in public schools and accepting all kids, no matter what challenges they bring to the table. So I'm passionate about our reside schools. So Shawnee High School, if you live within a few blocks of Shawnee High School, this is not you come in and I'm sorry, your grades aren't good enough, your attendance isn't good enough. Right. You're coming and we are meeting your needs. And I'm really passionate about that.
So talk about some of your successes to being a superintendent.
Yeah, I'd love to. So, in 2019, I really took on a change process that I said, we hadn't changed much in JCPS in 40 years. And I think a leadership lesson to learn is if you're in an organization that hasn't changed much in 40 years, you're probably going to go the way of Blockbuster or Circuit City. Right. And so we made a real aggressive change process called our Future State in 2019 that really changed. So, the student assignment plan, we were successful at changing that, which I think is going to change outcomes for kids. Our facilities plan, we're in the process right now of building 20 new schools in the next decade, which I'm just so proud of. Building new schools in West Louisville, 2 new schools in West Louisville that none in this century have been built in West Louisville. We have 2 new schools being built. technology where all kids have access to cutting state-of-the-art technology now, resourcing our highest poverty schools. I could go on and on with the change. Curriculum, the same in every school across this district, reading and math. Used to be you could go into schools, elementary schools would be a different way to teach reading, and kids change schools every day. And so imagine going from one school to the next as an elementary school student and not having the same way to teach reading. We do that across every single of our 165 schools now. So all of those changes I'm extremely proud of that I think are just going to change outcomes for kids. I'm proud the fact that we have fought through two of the greatest crises in education history, which is a pandemic and severe staffing shortages, and still making those changes. Yeah. Really proud of the academies of Louisville. People say to me all the time, we need to get kids in vocational. We have 22,000 high school kids right now in career and technical education on pathways, which has changed our post-secondary readiness, the number that says when kids graduate high school, they are ready for college or career. We've gone from 50% to 83% in 7 years. Graduation rate is at the highest it's ever been. And we've eliminated the achievement gap between black and white students with the graduation rate. And so I'm just really proud of the work that we have done in this district to transform from what we were in 2017 to what we are now. And I think those roots are planted, and if this work continues, we're going to see unbelievable fruit coming from those trees.
At Park Duval Community Health Centers, we go beyond medicine, breaking barriers to care across Louisville, Taylorsville, and Eminence, Kentucky. From primary care and dental to behavioral health and pharmacy support, we serve thousands, many facing financial hardship. With 7 locations and a bilingual staff, we welcome everyone because PDCHC, your health is our mission. We are Park Duval for everybody, everywhere.
Hello, everybody, and welcome to Park Duval. My name is Desmond Pritchard. I'm your Chief HR Officer here at Park Duval. I'm located normally 9 times out of 10 at the Wilson location. I'm beyond honored to support our community, to work with our community. There's a lot ahead of us. We have a lot we're ready to do, we're willing to do, and we can't wait to have you on board, to have you doing it with us.
What you show up in is not what matters, it's how you show up.
Right.
So if you can articulate from your heart, they'll forget what you got on.
Because a lot of people want to Google
Yes.
medicine now,
Yes,
and it's very difficult.
it is. Would you Google if you had some sort of ailment that you were curious about?
I'm an epidemiologist by training,
Okay,
so
fair, so you know.
Folks, what are your credentials? And sometimes you have to pull them out and say, okay, here's this degree, here's that. You're like, oh, okay, maybe we should listen to you.
We're going to build a $40 million facility that allows parents to sleep better at night.
You know, I was watching this thing on PTSD, and they were talking about people in war, and they were like, you know, human beings are not wired to perennially be on alert, you know, in a state of alert.
Right,
and that's what happens
cortisone.
when you're at war.
Yeah, your cortisone level continues to go up, the adrenaline gland.
And that's what's happening to black people.
Do you think, because I wondered this, a lot of kids did NTI, a lot of kids wasn't as focused because, you know, I could do stuff on Zoom, but I'm a better student in person.
100%.
Right? Do you see any kids suffering from COVID?
Oh yeah, there is no doubt. Now I think we have now gotten to a point where for the first time this past year, I felt like there was a sense of normalcy where kids had begun to recover from that time from 3 years before. But it took a good 3 years. I think the lesson we have learned from this more than anything is school matters. You know, school matters for kids. So, I mean, I could go down a list of things that kids suffered from not being in school, from obviously academic support,
Right.
but mental health support, social services support, food, you know, having food on a daily basis, having interaction with other kids and adults, extracurricular activity. I mean, we could go on and on, but the lesson that I know from this is school matters. so much for kids. And it's one of the most important things we provide for the community. And that lesson was clear from that. So it took several years to recover. I saw when kids came back, there was significant discipline and behavioral issues that were occurring in schools that had not happened before. And it took us about 24 months to get that back to what it was prior to COVID.
You know, and I'm curious, it wasn't just the kids.
I would agree with you.
It was the adults. Like, something became fractured in our society from a mental health standpoint. I don't know what that is.
I would agree with you.
But I was, I saw kids doing things that they would have never done. The fights they would get into. I understand why I had kids come protest at the health department, so I get it. But they were willing to play basketball and risk their life. That was the only concerning part. And I was like, half your team is out. You can't even play a game no way. So what are we doing here? So moving forward, did you lose any kids due to COVID?
We did not directly that we know of. We had lost a couple of kids that happened during the time we were out of school. So the answer to that, I guess, is yes, not directly from being in school. So I'm proud of that. And to what I know of, there were one or two kids that I believe lost their lives to COVID, but it happened during those summer months. So that is very painful, obviously, but we did not see when we returned to school anything that led to that.
Yeah, so the one thing, I had an advisory council, and we would have these Zoom meetings because you couldn't meet in person. So Harvard Medical School is in Brookline, Massachusetts.
Correct.
And you have MIT, and Boston University down the street, and Tufts. And I was a professor at Tufts Medical School, and I had people from Harvard that lived in Brookline, and they was asking me, why did I value kids more than adults? Because I allowed adults to go to restaurants.
Okay.
And be close. And I simply had to ask, our kids are our future. And if you had a kid, you should think that way.
Yeah.
But it was astonishing to hear parents say that.
Yeah. It is one of the, I get asked before what keeps me up at night, and the safety of children is the thing that keeps me awake. If something happens on our watch as leaders that ends up, God forbid, costing a child their life, that is something that you never recover from.
Right.
So I completely understand what you're saying there.
Yeah, and I've seen school shootings. All my clinics right now we have security officers there on site. But how do you prepare for a school shooting?
I say this: you do everything you can to prevent these from happening. Right. Unfortunately, I do believe this: if we have someone who is intent on doing it, it's going to be really difficult to stop them. Right. I'll take a high school here in JCPS at 2:20 in the afternoon or 2:10 in the afternoon. You have 1,000 kids walking outside of about 4 doors. If someone wanted to do something, God forbid, they could. But I am proud of the steps we have taken. So first and foremost, we implemented weapons detection in our school buildings, which has reduced the guns that we've had in our schools almost to zero inside of our schools. We found 4 this year in students' backpacks at the weapons detection check, but none inside the weapons detection check. And that 2 years ago was 28. We have our own police department here in JCPS right now that is trained to prevent these things, but also support kids. We've got about 70 officers. That is something that JCPS never had before. So I think we're better than we have ever been in preparedness for that. We also, I believe, have put mental health professionals in every school. We have a very robust system of if there is a threat, like a social media threat, a very robust system of ensuring, is this a real, how do we, handle this? So I'm very pleased with where we have come with it, and I think a lot of that has prevented that possibly from happening. But unfortunately, I don't know if you can ever fully say, we've made it so it can't happen here, because, and that is, and I think that's anywhere, whether that's a health clinic, a school, a movie theater, a sporting event. You can take as many precautions and preventative measures as possible, but unfortunately, if someone is determined to do that, they're probably going to find a way.
And I just hope that our officers respond, because one time I was having a press conference and the mayor showed up, Mayor Greenberg, and I was making an announcement that I received $4.8 million from Mackenzie Scott. And there was a school shooting, and the mayor, he drove away that day. I was like, what just happened?
Yeah.
So I understand, but every time I hear that, because I have kids at school, I'm like, okay, do I need to go do something? Because I'm not going to be one of those parents that's going to wait.
Yep.
I'm trained to go into situations like that.
And the problem is, most of those situations that occur are swatting incidents, meaning someone calling in and saying there's an active shooter, and there isn't.
Right.
And the fear that causes in parents, students, staff, the community is just unfair to those people. And so that's a really terrible thing that has come to existence in the United States in recent, not just school shootings, but also young people deciding they're going to, have swatting calls call in when it's not actually happening.
Yeah, now I know, at least I heard, that it was controversial to have these detection devices at schools at one time. What feedback did you get from it?
So it was controversial. Now, I think, so metal detectors would not have been possible for us to put in, because it would just take too long to get the kids into school. Because how much goes off, like everyone knows a traditional metal detector, you're taking keys and your watch off and all of these things. The new weapons detections have been very successful because they have the ability to look for a certain type of metal that is in a gun, a handgun. And now the negative is they don't necessarily look for pocket knives and things like that, but they do look for handguns. And so it was controversial at the start because what we didn't want were certain kids being targeted to be searched on a regular basis, and instead, just based upon the weapons detection system alone. And so I have really yet to have any instance of when someone was, from at least my perspective, I'm not saying it hadn't happened, but from my perspective, I have not had one instance where a student has felt targeted based on the weapons detection system. So we've been very pleased with the results. It was controversial at the beginning, but when you go from 28 guns being inside of a school to 0, I think that's a pretty big step.
The data shows, and I love data.
Yep.
My name is JT Douglas, and I am the Director of Development and Marketing here at Park Duval. I'm in charge of all of the fundraising efforts to help us do some of the great work we do here at Park Duval. The people that come to Park Duval, they're here for a reason. They're here to see us. They're coming to the health center because they don't feel good. And I think it's great work that our physicians and providers do for those patients by helping them.
At Park Duval Community Health Centers, we believe healthcare is for everybody, everywhere. Our 7 locations across Kentucky provide affordable, high-quality care no matter your income. We are Park Duval.
Tune in to CEO Live Talks with Dr. Swannie Jett every Saturday at noon on Wave 3. In this thought-provoking series, we bring you conversations with influential leaders, visionaries, and changemakers who are making a difference in their communities and beyond. Don't miss an episode. Mark your calendar for Saturdays at noon on Wave 3 to watch CEO Live Talks with Dr. Swannie Jett. Together, we can shape a brighter, healthier future for all. So I'm sure you have already done a SWOT analysis.
Have?
Because that's what good leaders do. Before you take a position, you come up with a plan. So what do you look to, I would say, enhance an Ivy upon your arrival?
Yeah, so let me say this. For the first time in my career, I'm taking over a position, a leadership position, where the institution is currently in great shape. That's not been something that I've had the opportunity to do in previous, so leadership positions where I've had to act immediately. So when I took over JCPS, we were facing state takeover. And so it was a matter of, I didn't have time, or a lot of time to just sit and listen. We had to act and act quickly. I'm in a position now where the institution is in a very good spot, very successful. And so that's new for me as a leader. So first and foremost, and I've taken this very serious, is to listen as much as I possibly can. I'm doing listening tours in July around the state. I'm visiting all 19 campuses to talk and listen to the chancellors of each of the campuses. I just want to hear from people. And so they've done an exceptional job. The current president, who is outgoing and retiring, Sue Ellspermann, has done a fantastic job with her leadership and the team up there. But I think it's clear, I've also found there's a lot of room for improvement too. And so whether that is increasing the amount of high school students that are receiving those dual credit or dual enrollment hours, to apprenticeships, to retention rate. Retention rate has been a huge focus, but it's still, fall to fall is about 55% and across the campus. And so, that is an important thing, is to increase, and that's a challenge at community colleges across the nation, because kids leave for a variety of reasons, whether that's financial, family reasons, we know this, but keeping kids on that track to a certification or a degree is critical. So for me, it's going to really look at ways I can increase that retention rate, increase enrollment, increase certifications and completions. And so the good news is I've got a few metrics that I'm just really going to hone in on, those three, and say we're going to tackle those and continue to do great work. But more than anything for me, it's listen right off the bat.
Yeah, so you make an excellent point. Anytime I assume a new position, I spend probably the first 3 months listening.
Yep.
And I have some people transcribing notes for me. I'm looking at, what's 3 things we can improve?
Yep.
What's 3 things that we need to get rid of? Or what's 3 things going great? And then I sort of start strategically using my SWOT analysis.
Yep.
And develop a strategic plan. So.
And for me, it's exactly the same thing. And I have to be honest with everyone.
Right.
I'm not coming from post-secondary. I'm coming from K through K-12 education. So I think the leadership-wise, I know the leadership skills it takes, but I don't have the expertise at post-secondary. So I can't come in acting like I'm an expert on this.
Right.
I need to learn, have that learning curve. I need to listen to people, trust the people around me. And then once I get that where I need to be, then I can make some decisions about where we're going long-term in collaboration with everyone else.
Right.
But acknowledging I'm not the expert is an important step in that too.
Well, one thing I know for sure, you will get this. Less stress.
I think so. Thank you so much.
And this concludes CEO Live Talks for the day and my guest, Dr. Pollio. Thank you.